The following segment is sponsored by American Association of Endodontists. Don't let fear of a dental injury keep you from playing your favorite sport. Dr. Craig Hirschberg is here to share what you can do to protect your teeth. Welcome, doctor. It's great to see you.
Great to see you, Carrie.
So what did your latest survey reveal about people's fears of sports-related mouth injuries? This is interesting.
Well, we were surprised to learn that a third of the respondents never played sports out of fear of getting a tooth knocked out. And a similar number feared having a tooth knocked out more than breaking a bone or having a muscle tear related to a sports injury.
Wow. And what are your tips if someone does have a tooth knocked out? What would you say? What advice do you have?
Well, time is of the essence, and the most important thing is getting that tooth back in the jaw as soon as possible. So, locate the tooth, shake it free of debris, try to wiggle it right back in the socket. Now, understanding that that isn't always possible, or maybe it's, beyond somebody's comfort zone, you need to get someplace where the tooth can get put in as soon as possible. But if you can't replace the tooth yourself at that point, what's important is that the cells on the surface of the root of that tooth need to be kept moist. So the ideal thing would be to place that tooth into a container of milk, preferably as cold as possible, and then get to an endodontist, to your dentist, or to an emergency facility to have that tooth put back in the socket and stabilized.
Okay, interesting. Thank you for that advice. And can you explain the difference between an endodontist and a general dentist for us?
Sure. So an endodontist is a dentist, but they've had a minimum of 2 years of additional training in advanced endodontic procedures, and root canal treatment is an endodontic procedure, and also in advanced pain control. And endodontist offices are set up in a manner that they are accustomed to accommodating patients in emergency. So chances are, if you were to call an endo office and report that you've had a traumatic tooth injury or you're having a toothache, that they would ask you to come right over.
Okay, all I know is we need you in our life to help save our mouths. You're doing superhero things. Doctor, where can we go to learn more?
So our association's website, AAE.org, has an entire area that's devoted to patient information.
Fantastic.
And we also have another resource, which is findmyendodontist.com, which allows patients to access a database that can, help them find an endodontist that's close to them. And, especially for patients that may be having a toothache or patients that have sustained dental trauma, they can refer themselves directly to an endodontist.
Thank you for all this info and advice. You're wonderful. Thank you, Dr. Hirschberg. Have a wonderful day. We'll see you later.
Thank you, Carrie.